Understanding Non-Communicable Diseases, NCDs, a Global Health Challenge Introduction. Non-communicable diseases, NCDs, pose a significant global health challenge, contributing to a substantial burden of morbidity and mortality worldwide. These chronic diseases, which are not caused by infectious agents, encompass a range of conditions that affect individuals of all ages and socioeconomic backgrounds. In this comprehensive guide, we'll explore the four main types of NCDs: cardiovascular diseases, cancers, chronic respiratory diseases, and diabetes, examining their prevalence, risk factors, impact on public health, and strategies for prevention and management. Cardiovascular diseases. Cardiovascular diseases, CVDs, including heart disease and stroke, are among the leading causes of death globally. These conditions affect the heart and blood vessels, leading to complications such as heart attacks, heart failure, and strokes. Risk factors for CVDs include hypertension, high cholesterol, smoking, diabetes, obesity, and physical inactivity. Prevention strategies focus on lifestyle modifications, including healthy diet, regular exercise, smoking cessation, and management of risk factors. Cancers. Cancer is a diverse group of diseases characterized by abnormal cell growth and proliferation. It can affect various organs and tissues in the body and is associated with significant morbidity and mortality. Risk factors for cancer include tobacco use, excessive alcohol consumption, unhealthy diet, physical inactivity, environmental factors, and genetic predisposition. Prevention efforts emphasize tobacco control, vaccination against cancer-causing viruses, such as HPV, early detection through screening programs, and lifestyle changes. Chronic respiratory diseases. Chronic respiratory diseases, such as chronic obstructive pulmonary disease, COPD, and asthma, are characterized by persistent respiratory symptoms and airflow limitation. These conditions impair lung function and quality of life, leading to respiratory distress and disability. Risk factors for chronic respiratory diseases include smoking, air pollution, occupational exposures, indoor biomass fuel use, and respiratory infections. Prevention strategies focus on smoking cessation, reducing exposure to indoor and outdoor pollutants, vaccination against respiratory infections, and early diagnosis and management of respiratory conditions. Diabetes. Diabetes is a metabolic disorder characterized by elevated blood sugar levels due to insufficient insulin production or impaired insulin action. It can lead to complications such as cardiovascular disease, kidney failure, blindness, and lower limb amputations. Risk factors for diabetes include obesity, unhealthy diet, physical inactivity, family history of diabetes, and ethnicity. Prevention and management strategies include healthy eating, regular physical activity, weight management, blood sugar monitoring, medication adherence, and diabetes education. Impact of NCDs on public health. Non-communicable diseases have a profound impact on public health and healthcare systems worldwide. They contribute to premature mortality, disability, decreased productivity, and increased healthcare costs. The burden of NCDs disproportionately affects low- and middle-income countries, where resources for prevention, diagnosis, and treatment may be limited. Addressing the NCD epidemic requires a multi-sectoral approach involving governments, healthcare systems, civil society organizations, and the private sector. Prevention and management strategies. Preventing and managing non-communicable diseases requires comprehensive strategies that address modifiable risk factors and promote healthy behaviors across the lifespan. Key interventions include health promotion and education, promoting healthy lifestyles through public health campaigns, educational programs, and community-based initiatives to raise awareness about the importance of physical activity, healthy eating, tobacco cessation, and regular health screenings. Policy interventions. Implementing policies and regulations to create environments that support healthy behaviors, such as tobacco control measures, taxation of sugary beverages, promotion of physical activity, and regulation of food marketing to children. healthcare infrastructure strengthening, improving access to quality healthcare services, including primary care, preventive services, screening programs, and treatment options for NCDs, particularly in underserved communities. Research and innovation, investing in research and innovation to develop new treatments, technologies, and interventions for the prevention, diagnosis, and management of NCDs, as well as understanding the underlying determinants of these diseases. Conclusion: non-communicable diseases represent a significant global health challenge, with cardiovascular diseases, cancers, chronic respiratory diseases, and diabetes contributing to a substantial burden of morbidity and mortality worldwide. Addressing the NCD epidemic requires a concerted effort from governments, healthcare systems, communities, and individuals to implement comprehensive strategies for prevention, early detection, and management. By prioritizing health promotion, education, policy interventions, healthcare infrastructure strengthening, and research, we can reduce the burden of NCDs and improve the health and well-being of populations around the world.